In this video, we're going to cover 6 symptoms and signs that can be linked to bowel cancer. However, before we cover these, I want to point out that some of these symptoms are not specific to bowel cancer and they can be caused by other conditions. Nonetheless, if you do have any of these symptoms, it is worth speaking to your doctor who can help you try to find the underlying cause. So the first important symptom to be aware of is a persistent change in bowel habit. So this means a change to your normal bowel habit that's gone on for more than 6 weeks and it's not getting better or returning to normal. For example, you might find that you're pooing more often, or you might have looser, runnier poos, sometimes accompanied by tummy pain. Either way, if you've noticed a persistent and ongoing change to your bowel habit, then you should speak to your doctor. Now, the second important sign to be aware of is blood in the poo. This can be obvious visible blood, but it can also be microscopic blood that's mixed in with the poo. And this is picked up on something called a fecal immunochemical test, also known as a FIT test. Now, although seeing blood in the toilet after pooing can be scary, it's important to remember that there are lots of other non-sinister causes of this, such as hemorrhoids, which are also commonly known as piles. But either way, if you have noticed bleeding from your bottom, you need to be assessed by your doctor either way so that they can help you try find the underlying cause. Now, the third important symptom is unexplained weight loss, especially if you're aged over 40 and have lost more than 5% of your total body weight in the preceding 6 months without intending to do so. By this, I mean you haven't been dieting or increasing the amount you exercise in order to lose weight. Although there are many factors causing weight loss, if you also have rectal bleeding, abdominal pain, and you're aged 40 or older, this does raise suspicion for possible bowel cancer. Now, the fourth sign that needs to be investigated for possible bowel cancer is a mass in the abdomen, rectum, or anus at any age. Again, there are lots of possible underlying causes of this sign, which may not be bowel cancer, but it is something that needs to be explored further. Now, the fifth symptom is abdominal pain, discomfort, or bloating, always brought on by eating. This sometimes results in a reduction in the amount of food eaten and results in that weight loss. Now, the sixth symptom is feeling tired all of the time. Now, this, admittedly, is a very vague symptom, but your doctor will most likely check your blood. If they notice an iron deficiency anemia, meaning low levels of iron causing low hemoglobin levels, they might explore this further, taking into account things such as your age and the possible underlying reasons as to why you might be feeling like this. Now, it's important to know that many people with these symptoms or signs don't have bowel cancer. Other health problems can cause similar symptoms, but it's really important that if you do have any of these things, or you just don't feel right, to go see your doctor or family doctor who can investigate and explore things further. Now, knowing the symptoms and signs and acting on them as quickly as possible could mean that if you do have bowel cancer, it may be diagnosed earlier when it's much easier to treat. People whose cancer is diagnosed at an early stage have got a much higher chance of successful treatment than people whose cancer has become more widespread. Also, please don't be embarrassed and don't ignore any of the symptoms. Doctors are used to seeing lots of people with bowel problems and it's something we deal with all of the time. We'll do our very best to help you try access the right tests and investigations if these are indicated. Finally, it's important to be aware that in some cases, bowel cancer can stop digestive waste passing through the bowel, and this is known as a bowel obstruction. Symptoms of a bowel obstruction can include intermittent and occasionally severe abdominal pain. This is always brought on by eating. Unintentional weight loss with persistent abdominal pain, constant swelling of the tummy with abdominal pain, and being sick or vomiting, again with a constant abdominal swelling. Now, a bowel obstruction is a medical emergency. If you suspect that your bowel is obstructed, then you need to go to the accident and emergency department of your nearest hospital immediately. Finally, I've included a useful link in the description box of this video to a symptoms diary from Bowel Cancer UK, which you can download and fill in. This might be a useful thing to bring with you to your doctor's appointment if you're having any of the symptoms we've discussed. So that brings us to the end of the video. If you learned something new, please could I request that you consider giving the video a thumbs up and leaving me a comment in the comments section. Also, if you've not done so already, please consider subscribing to the channel and I'd be very grateful if you would. Thank you again for watching, and until next time, bye.